Scars occur as a natural physiologic response to trauma. So plastic surgeons work to mitigate scarring through multiple different approaches. One is just surgical planning and trying to hide those scars in areas of natural creases in the face or areas that aren't seen very often, underneath the breast, underneath underwear, in the abdomen. Besides surgical planning, it's a lot about surgical incisions. They're made very precisely, and then the closure of those incisions also will help mitigate scars. Post-operatively, there are other things that we do to mitigate scarring. There are certain types of creams and other types of products that do help with scarring, and I think that people use a lot of those products, and I think what those products do is probably shorten the time frame to get to that end point. So I don't think there's any magic potion out there that's going to make people's scars go away. One of the ways to help scars mature is to massage them. Usually we don't start any kind of scar care until at least 2 weeks after surgery, when people start to begin that inflammatory response. And it's essentially intended to help with the remodeling process. And obviously you don't want to do it too early because there's not enough strength there and you can damage your incision or make things worse. But typically the massaging is done with a heavier ointment or cream, kind of a medium pressure. Scars also contract, so if you have a straight line scar, you want to massage it parallel along that area where it will contract, kind of prevent that from happening. Usually it's a couple of times a day. As people progress in their healing process, and depending upon where the scar is, sometimes we'll just have people use nice sunscreen that also will protect the new scar from the sun and the UV rays, and it will also, they can use it to massage. But there are multiple things that we do to try and make it look like we didn't do surgery and have those scars fade as nicely as possible. I mean, if anyone is concerned about their incision, how their incision looks after their surgery, they definitely should call the office, because it could be a sign of something else going on, whether it's an infection, or sometimes the body will reject the stitches that we put in there. And just, if anyone has a general concern, I'd rather have them call than not call. It's just best to have it be evaluated, and oftentimes, like I said, it's mostly a time issue, but if anyone's concerned, it's nicer to know about it sooner rather than later.